Hi everybody, thanks for joining us once again. I am Molly Bachtel and I am here to present you with another round of case studies. This time our topic is vaginitis and sexually transmitted infections. So without further ado, we'll go ahead and get started with our first case. And here is Mary Frances. She is a 22-year-old female patient coming to see you at your student health service. And she's coming in with a complaint of a vaginal discharge for about 1 week. She's had a couple new partners over the last 3 months. She did have some unprotected sex in which she did not use condoms, and I should qualify as vaginal sex, with 2 or 3 male partners. She reports there is a little bit of itching, not too much. She kind of feels irritated. And there does seem to be an odor to the discharge, especially after sex. It's not too pleasant. She didn't quite call it fishy, but kind of. And, you go ahead and let her know that we need to go and do a pelvic exam to check this out a little better. So you help Mary Frances get situated on the exam table, and her feet are up at the stirrups, and you use the speculum after doing the external examination, and the speculum clicks open, and this is what you're seeing here. There looks to be a discharge. How would you describe this discharge? Yes, this discharge does look to be kind of a milky, thin discharge, and it does have a little bubbly consistency to the discharge as well. Some might call this frothy. And here's another view that actually is much more frothy looking, has the little bubbles. So we're back to Mary Frances, and we help her get situated after the pelvic exam. You did it by manual, there's no tenderness, and you do have a swab that you collected during the exam, and you let Mary Frances know she can go ahead and get dressed, and you're going to just take a look under the microscope at the sample to help determine what this might be going on. All right, and I know you covered this in your health assessment lab, but let's go ahead and watch this quick reminder video of how we're going to set up our wet prep.
Today we are going to teach you how to do a wet prep and why it's important. Basically, a wet prep is a sterile swab of the vaginal discharge viewed under microscopy. This is an important and very simple test to quickly support clinical diagnoses of vaginitis. It is much quicker than sending samples to the lab. Training is quick and simple, and supplies are relatively cheap. A wet prep is done when there is a complaint of vaginitis or noticeable discharge on exam. A sterile swab is used to sample fluid from the posterior fornix during a pelvic exam. The swab is then placed in a test tube and saline is added. Once in the wet prep room, wear gloves. A sample from the test tube is placed on a slide and covered with a cover slip. Using a 40 power lens, the sample is inspected for epithelial cells, which are cells that will have flat, clear, and crisp borders, yeast, which will be budding and branching, clue cells, which will be cells in which bacteria obscures the borders, trichomonas, in which you will see moving flagella, and the cells are slightly bigger than white blood cells. If bacterial vaginosis is suspected, a vaginal pH collected during the pelvic exam and a whiff test are performed. A few drops of KOH are added to a test tube. If positive, the odor of the tube will change to a fishy smell. If yeast is suspected during examination, then a KOH prep is used. A slide is prepared in the same method as before, then a drop of KOH in the brown bottle is added. This allows the branching hyphae to be visualized. And that's how you do a wet prep. Place a sticker in the book with your findings, then come tell a resident. And remember, if you are unsure at all about what you see, ask for help. We would be happy to show you. Remember, do not perform a wet prep without gloves. Do not eat in the wet prep room.
All right, and thanks for watching that review video on wet prep. Let's go ahead and check out Mary Frances's wet prep now that we've reviewed how to properly complete the wet prep. And here's Mary Frances's wet prep. You see the epithelial cells, and then there's this object that catches your attention. It's a rather large round object, and there is a little tail, just very faint. You're going to keep looking because you want to be sure. There's another one here. It's rather large. You're going to faint wiggling. More epithelial cells. There's another. I think you're close to making your diagnosis. All right, I'm sure most of you chose correctly. This young woman does have Trichomonas vaginalis, which is a common sexually transmitted infection that is a parasitic etiology and is curable. So let's go ahead and come up with a plan for Mary Frances. What prescription would you like to give Mary Frances for this infection? Assume that she has no known allergies to medication. What other labs might you want on Mary Alice, or at least to offer her a chance to have done, considering the fact that she does have one infection that is sexually transmitted? Education. What points of education do you want to be sure to mention to Mary Frances? And lastly, follow-up. What is your plan for follow-up for Mary Frances? All right, Mary Frances is on the way to the pharmacy, and now you're seeing your next patient. This is Zoe. She's a 29-year-old African-American female. She also has a complaint of vaginal irritation and discharge. In her case, this has been going on about 2 weeks since her last menstrual period. Her periods have been regular. She is on oral contraceptives, the orthocycline. She has a 2-year-old daughter and plans to stay on birth control for another year before she tries to have another baby. She's in a monogamous relationship with a male partner, and she's coming to you for advice. She did say she caught strep throat about 3 weeks ago from her daughter who attends daycare, and she had a round of antibiotics. Okay, and now it's time for Zoe's pelvic exam. You inspect the external genitalia and everything looks pretty normal. There's no excoriations noted on the vulvar area nor any worrisome lesions. So you go ahead and do the speculum portion of the exam, and this is what you're seeing on the image in front of you. So how would you describe this charge? It's also white. Yes, I agree. It does have a chunky appearance to it, whereas the other exam we did this morning had a smooth, kind of homogeneous, thinner discharge. And once again, after wrapping up your pelvic exam, you assist the patient getting covered up quickly and let her know you've collected a sample. And again, you will want to look at under your microscope to see what is going on. Okay, and you have your initial wet prep in focus, and you see some epithelial cells. Doesn't look like these are clue cells. They look like they have pretty clean edges. They're not peppered in bacteria. And then we're going to look over here as well. I'm going to move my screen. Okay, and here we have something showing up in between the normal epithelial cells that looks like a pseudohyphae, and this is on just the normal saline prep. So this is enough of a clue. Let's go ahead and do the KOH for this patient. All right, and this KOH slide does show both some yeast buds and hyphae. You can see that we like to call the spaghetti meatballs sometimes. You also see what the KOH is doing to the normal epithelial cells. They're kind of lysed and kind of fading out in the background. So it breaks down the cell wall so you can see the buds and hyphae more clearly. So it looks like we have our diagnosis. Here's another image of some yeast buds and hyphae on a bed of lysed epithelial cells. The pseudohyphae look tubular and they appear to branch. And it is important to focus up and down because organisms can be in different planes of focus. So you may just move it ever so slightly and see a lot more clearly what's going on. Okay, great job. You've made the diagnosis of vaginal candidiasis or a vaginal yeast infection. Now, to come up with our plan, the first thing is, what are we going to prescribe? In the case of candidiasis, this is not considered an STD. So this will not be on the reference guideline that we're going to use for some of our other case studies. Okay, and here's an image of the STD guidelines from the CDC that has a wall chart and a pocket guide that we're going to use for our other guidelines. As you can see, BV's listed on there and lots of other stuff, but they don't list yeast infections here. But you're a quick Google search away from some guidelines from the CDC on candidiasis, and it's at www.cdc.gov/std/tg 2015/candidiasis.htm. So if you put in that address, you can find these guidelines. And you can scroll down here and see there's lots and lots of options here for Zoe. And before we move on for Zoe, I just want to show you this slide summarizing the findings with yeast and vaginitis typically. We already saw the saline and KOH slide. A negative whiff test was also obtained on Zoe, and the pH on the swab was less than 4.5. Okay, so you've chosen the prescription for this patient. Some things to consider with that are sometimes they've already tried something over the counter, so you may want to move on, or maybe just from the get-go, a patient may want to do an oral antifungal such as diflucan. And in that case, the dosage is diflucan 150 milligrams, a one-time dose. Sometimes people will have yeast infections following a course of antibiotics, and this certainly may be the cause for Zoe. It's also important to inquire about if she is someone who uses vaginal douche. You would think this has become less popular over the years, but in fact, some people still are doing that, so it's important to educate them on that. As far as other lab work, it's never wrong to offer STD screening, even though this isn't a condition that would be a red flag for me to really push for ordering that. But if she's wanting to be screened for gonorrhea and chlamydia, HIV, syphilis, it's never wrong to do so. And then typically a follow-up can be added as needed if the symptoms don't improve within a week. Sometimes even if you're using diflucan, you can encourage them to get one of the over-the-counter antifungals if they're having vulvar symptoms as well, where you're seeing, a benefit of using a topical cream in addition to the oral antifungal. All right, and this concludes the case studies in this section. I hope you enjoyed them. There's going to be other modules linked in a separate recording, so I'll give you a little break and see you back for the rest of the case study shortly. Thanks.